In the city of Detroit, on the east side, change is taking place. Ordinary citizens, churches, local government, private businesses, schools, law enforcement, and grassroots organizations are joining forces. They're standing up, they're saying no, and they're working together to fight substance abuse and its negative effects in their communities. The Empowerment Zone Coalition is the result of this collaborative community effort. The Empowerment Zone Coalition, or EZC, is a 501c3 nonprofit that actively works to mobilize communities against the abuse of alcohol, tobacco, and other drugs, and to build on community strengths to create positive change.
A large percentage of the crimes that are committed are done so under the influence of alcohol or other drugs, or that they're done because of alcohol and other drugs. We know that the problems that are brought to family court, many of them, 50–60% of them, are there because of alcohol and other drug abuse problems. We are full aware of the damage that are done to families, to youth, to adolescents as a result of addiction.
Drunk, high, or hungover, substance abuse is costing everyone. Hangovers cost society approximately $148 billion annually. Light and moderate drinkers cause 60% of alcohol absenteeism, tardiness, and poor quality work. It's not just alcohol. 76% of illegal drug users are employed full and part-time. That's 10 million people, more than the population of Michigan. And workers who are abusing are getting younger and younger.
I think that if people knew that injection drug use was the second leading cause of HIV infection among black men, they would be surprised about that. I think that if they understood that substance abuse accounts for about 45% of the HIV/AIDS cases in the Detroit area, they would be surprised about that.
My name is Latasha Booth, and I am HIV positive. I found out when I was 21 years old, and for the last 5 years I worked with adolescents from the ages of 13 to 24 who were both infected with HIV as well as at risk for becoming infected with HIV.
The disease is very serious when it gets from HIV to AIDS, and it's a traumatic experience that I experienced, seeing someone that you birth leave before you. And the community really needs to become more aware of the disease and gather information.
I think we have to recognize that one of the keys is prevention. Running a jail system where 85% of the people are in there either directly or indirectly on a drug charge, I think what is so important for us to realize is that we can't build our way out of this issue or out of this problem. And so what we have to do is concentrate on awareness, education, treatment, and make sure that people understand that this cuts across all socioeconomic boundaries, that it's in the suburbs as well as in the city. And this isn't a Detroit versus Out County, this isn't Wayne County versus Macomb and Oakland. This is an issue for all of us to tackle, and especially to do it with treatment and prevention programs. That's one of the keys.
And as you look at what those elements that actually help to get us to this point in time where parents aren't able to care for their children, where people are being incarcerated at alarming rates, where persons are unable to complete school or a job, what was it? What was the common denominator? And without question, it was substance abuse. And so to be addressing that at this time, and the fact that this organization for the past 7 years has been working on this issue diligently under the leadership of Doreen Turk White, means so much to me.
Since 1996, when she created the Empowerment Zone Coalition, Doreen Turk White has mobilized an effective coalition for change. The EZC has reached out and into the community and has recruited more than 100 members. Faith-based leaders, family service organizations, businesses, law enforcement, schools, and residents work together, unified, in creating programs with a singular goal: a safe, healthy, and drug-free society for the citizens of Detroit. And it's working. Over the years, the EZC has conducted a successful community needs assessment to determine the extent and magnitude of the drug problem, built a strong coalition across all sectors of the community, conducted quarterly workshops to educate the community about substance abuse issues, held 9 annual substance abuse summits to discuss drug-related issues and solutions among the hundreds in attendance, launched pioneering programs in Detroit schools that were turned into national drug and alcohol prevention models, developed the You Got the Power peer program for youth aged 10 to 17, and a Parent Power training and family development project, organized neighborhood events and, with faith-based groups, Freedom Sundays in conjunction with Martin Luther King Jr.'s alcohol and drug-free legacy, and successfully advocated for public policy change. The Empowerment Zone Coalition has also worked hard to spread the word, and the Empowerment Zone Coalition has been recognized nationally as a leader in effective coalition building. It has been awarded local and federal grants, and among other distinctions, it was named Outstanding Coalition of the Year by the National Community Anti-Drug Coalitions of America.
Well, I think one of the most important efforts is to maximize the existing resources and to make sure that those agencies that are receiving public monies to provide services are certainly delivering accountable and effective services. And we have improved that, I believe, through the collaboration that is exemplified by the Empowerment Zone Coalition.
The Empowerment Zone Coalition is effective grassroots activism at its best. But to continue reaching out into Detroit's communities, making them healthy and drug-free, it needs and deserves your support and funding. The EZC needs to raise $100,000 to continue its good work. Please consider making a donation and help the EZC to expand its resources. We also need volunteers, in-kind donations, loans of employees with technology skills, endorsements, or companies committed to turning around this community can adopt the EZC for a year and see the positive difference their support can make.
I want people to know that while substance abuse may seem like an overwhelming problem, and it's been going on for a long time, but it's still a problem that each and every one of us can make a difference.
The feeling is there that we're serious about turning Detroit around, and that we're serious about a renaissance in Detroit. And we're serious that we want Detroit to be a place where people can live in safety and security and in good health with good schools and great families.